Okay, so lollipop versus anchor scars. Which one is better and why do surgeons choose one over the other? So the first reason why is just going to be surgeon preference. So depending on where your surgeon trained and what their typical patient population is, they've probably developed a method that is comfortable for them, that they know gets good results, and they want to stick with what they know works. And I always say in my videos, once you pick a surgeon that you trust and you want to move forward with them, always go off of what they recommend because you want your surgeon comfortable. That's how you get the best results. Now, the second reason why we choose one over the other is just what we're dealing with, because certain problems require certain incisions. So if you're a massive weight loss patient, you've lost 150, 200 pounds, you have tons of extra skin, the only way we can get the contour that's nice in that area is with an anchor pattern incision. A vertical pattern or lollipop just won't cut it. If you're having a very, very large reduction with several thousand grams removed, an anchor pattern is really the only way to get the contour that we need and want. But if you're having a little lift or a little reduction, then often all you need is a lollipop pattern incision. The patients in the middle, though, is where it's really going to come down to surgeon preference. Now, when it comes to scarring, it really just depends on what you personally want to do and what's going on with your scar. So the natural history of scarring is that after surgery, everything looks good for about 6 to 8 weeks, which is why a lot of surgeons show you those early results bragging about their beautiful scars, because after that time period, all scars get a little thicker and a little more pink. And then over the next 6 months to 2 years, this will fade. So if you understand that that's going to happen, you can do things to help that process happen faster. So once you've initially healed, starting some kind of silicone scar gel is going to be really helpful with your scars fading faster. And so I like the simple ones that don't have a lot of ingredients. So just plain old boring silicone. The other things tend to cause reactions and can make scars worse. Now, when it comes to lasers, and we'll throw microneedling in there, those are wonderful too, but I usually in my practice reserve them for patients that need them and have issues. There are some studies though that show that early laser treatment series can help your scar look better, and that's certainly reasonable as well. So when it comes to laser treatment, it's really just going to depend on what your issue is. We have lasers that can remove pigment, we have lasers that remove pink, we have lasers that help with texture, and it really just depends on what you need. Now, if you don't have any issues and you're just doing early laser to try to help the scar look as good as possible, I usually recommend a series of 3 to 5 fractionated non-ablative laser treatments, and that's usually kind of the best way to get a beautiful scar quickly. So hopefully that helps. Let me know if you have any additional questions.